Arsenal and welcome to Sex and Stuff. Today's episode is all about viral STDs. Now, a virus is a little bit different from a bacterial STD if you watched our video last time. Like we had talked about, a bacterial STD can be cured with antibiotics. Now, a viral STD cannot be cured with medicine. We might take medicine if we have a viral STD to help treat some of the symptoms to make us feel better. But ultimately, that virus is either going to be in our body for the rest of our life, or sometimes, luckily, our body can clear it on its own. So that's a little bit of how a bacterial and a viral STD are a little different. Now let's talk about one thing first. How do we always stay safe and protect ourselves from STDs, okay? We use protection. We use condoms if we're having sex. We use a dental dam if we're performing oral sex on a female, or we use a condom if we're performing oral sex on a male, okay? We can get STDs any type of sex we have, whether it's anal, vaginal, or oral sex. We can get those STDs. So we're going to talk about today, we're going to talk about genital herpes, human papillomavirus or HPV, HIV and AIDS, and hepatitis B. We don't have a little microbe for Hep B, but today we'll talk about all 4 of those STDs. Okay, first we're talking about genital herpes. Now I can get genital herpes in a couple of ways, okay? So let's talk about the strain of herpes first. So there are different strains of herpes. There's HSV1, which is a cold sore, or HSV2, which is genital herpes. Now if I have a cold sore on my lip and I perform oral sex on someone, that's how I get genital herpes, okay? I can also get genital herpes when I have unprotected sex with someone. So if my vaginal fluid or semen comes in contact with someone's vagina or anus, that's how I can get genital herpes. I can also get genital herpes if I have those herpes sores and our genitals are rubbing. So those are the ways that we can get genital herpes. Typically, a genital herpes is going to look like a red bump that's going to appear on our genitals anywhere we engage in having sex. That bump is going to weep fluid, it's going to scab, and then it's eventually going to go away. Sometimes they last for a while, sometimes they don't last for a long time. Now we can take medicine, we can take antivirals, but just because I take an antiviral doesn't mean, again, that virus is going to go away. I have this virus my whole entire life. Now an antiviral may help alleviate the symptoms, or it may help reduce the number of outbreaks. But again, just because I have this virus doesn't mean it's going to go away. You also need to remember, just because I don't have a sore doesn't mean I can't pass it on to my partner. This virus lives in my vaginal fluid or semen, and I can easily give it to my partner as well. Now, my doctor is going to test me by either, if I have a sore, they're going to swab the sore and be able to tell if it's genital herpes, or they're going to be able to do a blood test to know if I have genital herpes. So this is an STD I will have my whole entire life, but ways I can be safe is by using protection. Second is HPV, which stands for human papillomavirus. Now HPV is the most common STD in the United States. About 90% of the population has it. So if you've had unprotected sex in your lifetime, 90% of that population has HPV. Now it can do a couple of things. Sometimes the virus can go away on its own. Sometimes it can live in our body or do nothing. Sometimes it can cause cancer. Sometimes it can cause genital warts. So let's talk a little bit about the viruses that can cause cancer. So HPV is broken up into 2 different strains. There can be high-risk strains and there can be low-risk strains of HPV. The high-risk strains ones can cause cancer. In women, it can cause mouth, throat, vaginal, cervix, and anal cancer. In men, it can be cause mouth, throat, penis, and anal cancer, okay? A lot of times we're not going to know we have this because there is not a test done for it. So if you have not gotten your Gardasil vaccine, this is something that you really need to get. This is going to protect you against the most common strains that cause cancer. So talk to your parent or guardian if you haven't gotten this vaccine and get it. The next ones are low-risk strains, and these are going to cause genital warts, okay? Genital warts are white, flat, grayish bumps that are going to appear anywhere on your genitals, okay? Remember, this is sex, so just like the high-risk strains and the low-risk strains, we can get this through any types of sex we engage in. Those warts are going to appear on our genitals. They're going to burn. They're going to spread, especially if they're growing. They're also going to itch. Now, we can paint medicine on them. We can freeze them off with medicine. We can burn them off. But just because I do that, the virus doesn't go away. Warts can pop up again. So this is a virus I can have my whole entire life. But remember, again, you can get HPV by engaging in any type of sex. Whether it's oral, anal, or vaginal, you can get the high-risk strains or you can get the low-risk strains. Next, we're talking about HIV. We can get HIV through vaginal fluid, semen, blood, or breast milk. We normally get HIV through vaginal or anal sex. We can also get it through oral sex, but that's typically more rare. But remember, we always want to use protection. We can also get it through blood if we're using a needle for drugs or for piercings, or moms can pass it to their babies through breast milk. Now, HIV and AIDS are a little bit different. So what happens is when we get HIV, it attacks our immune system, okay? It wipes out our immune system, that's what keeps us healthy. Now, if we're not taking medicine, daily medicine, which is called antiretroviral therapy, ART, it can turn into AIDS. And AIDS is the disease that we can die from, okay? So, HIV medicine has come a long way. With HIV medicine, you can live a whole, healthy life and die of old age. It's no longer a death sentence. People live full lives. And what we've also noticed with HIV is that if you take your medicine all the time, it's virtually impossible for you to pass it to your partner. So you become undetectable. But the only way that is if you take your medicine every single day. Now, it's hard with HIV. Some people have symptoms right away. Some people don't have symptoms right away. Every body is different, so you're going to experience symptoms with HIV differently. The most common way we test for HIV is through a blood test. We can do a rapid HIV test, and you can know under 30 minutes or not if you have HIV. So this is a really great information about HIV. And remember, always use protection. It's your number one best way to protect you from HIV. Last, we're talking about hepatitis B. Now, we can get hepatitis B through vaginal fluid, semen, and blood, okay? So we can get it through any type of sex we're having, and we can also get it through needles. So if we're sharing needles for drugs or tattoos, this is how we can get hepatitis B, okay? Now, we also need to remember with hepatitis B, there are very few symptoms, okay? They might be mild flu-like symptoms, and people don't even know if they have hepatitis B or not. One of the things that we need to remember with hepatitis B is that there is a vaccine for hepatitis B, and most people should have had the vaccine for hepatitis B. Now, sometimes people can clear this virus on its own, sometimes people can't, and we don't know why. If we don't get tested and treated for hepatitis B, it can cause a lot of issues. It can cause damage to our liver, and we cannot live without a liver. And long-term consequences may be cirrhosis or scarring of the liver, which means our liver hardens, can be liver failure, liver cancer, or liver damage. So it's really important that we get tested for hepatitis B, and we make sure that we are following precautions such as using protection every time we engage in sex. So like we had talked about, all of these STDs are viral STDs. Sometimes our body can clear them on its own, but for the majority of these, such as genital herpes, genital warts, HPV, and HIV, and hepatitis B, our body's not going to clear them. They're going to be STDs we're going to have our whole entire life. But the way to make sure that we don't get STDs is by using protection. So any type of sex you engage in, use a condom. If you're performing oral sex on a female, use a dental dam. If you're performing oral sex on a male, use a condom. And always remember, you can get tested, okay? So set up an appointment with your healthcare provider, your doctor, to see if you have any of these STDs. Thanks, everyone.